we are going to speak about lymphedema. Lymphedema surgeries are very common nowadays, but it is very new to India. And today we have here Dr. Sachin, I myself as plastic surgeon, and our cancer oncosurgeon, Dr. Sarvana. So this is just a discussion about lymphedema. Let us start with the first question. So what does this lymphedema mean for a layman?
See, when we do any type of cancer surgery, we have to remove lymph nodes. So the lymph nodes can be in the arm, can be in the legs, can be in the neck, anywhere. But very commonly, when you are doing surgery and removing lymph nodes for the arms or the legs, the arms become swollen after surgery. So we know that in our body there are many traffic systems. We would have heard in our biology class about artery, which takes blood from heart to other parts of body, veins which bring blood from other parts of body to the heart. But we don't realize that there is one more traffic system in this body called lymphatic system, and this is not visible when we do surgery. And that is why many times when surgery is done, especially for cancer, we tend to cut those vessels, and unknowingly the blockage happens and the arms and legs, they become swollen. This is called lymphedema, and lymphedema is a very troubling problem, and actually in India it is a problem which we require desperately some expert help.
So in your understanding, when shall the patient approach for understanding which stage or what kind of lymphedema he or she has?
When you look at lymphedema, you divide them into stages. Stage 1, stage 2, stage 3. But the problem with staging is, if it is not done by a dedicated team or an expert who is used to doing lymphedema treatment, sometimes the patients are lost. And I'm of the opinion that since we have started a program here, I'm always of the opinion that from the beginning, special attention needs to be given for the size of the arms or the legs after any cancer surgery, especially breast cancer surgery. Most lymphedema in our country, in India, actually happens after breast cancer surgery. And I think anybody who has undergone breast cancer surgery has to go and keep themselves checked regularly, not only for their cancer but also for the arm length. So the time is any time.
Sir, so how can a person himself identify that he has a lymphedema?
Since most of the lymphedema is going to happen in either the arms or the legs, the women who have undergone breast cancer surgery, when they usually approach us is, usually when they wear the blouse and the jacket, you see, suddenly they will find that the blouse is becoming too tight for them on the side where they have got operated, whereas on the side that they have not gotten operated, the blouse size is almost the same as before. So this must actually alert their mind to seek some kind of help. We normally see that even after the blouse becomes tight, they come to us 6 months, 1 year later, and sometimes it is too late to do anything at that time. So we always ask the patient to note whether the arm or leg which has undergone surgery or the procedure, they have to monitor it and make sure that if it is larger than the other arm, looking at the mirror, if they find a change in thickness, immediately they should seek help.
And this is subjective, but is there an objective way which you can find that there is a lymphedema?
So what we have realized in the recent past is that many times we look at the patient and say, lymphedema, is there lymphedema, is there grade 1 lymphedema, grade 2 lymphedema, and many people have different ideas about the grading of lymphedema. But there is one very, very important tool that has been developed in the last few years, and that is called indocyanin green near infrared camera identification and testing for lymphedema. So this is something which has totally changed the way we look at lymphedema patients. No longer we are just subjectively identifying somebody with stage 1 or stage 2. If you do this particular test using a dye, we give a small injection in the skin, and within half an hour we are able to see exactly whether this patient has lymphedema, what grade it is, and whether we can do anything to prevent the further worsening of this lymphedema. So this is called the indocyanine green near infrared camera system, and this system helps us to identify the different stages of lymphedema.